Hi, everyone. Welcome back to Black Minutes, Survival Steps to Beat COVID-19 in the African American Community. My guest today in the studio is Dr. Michele C. Reed, also known as the Fit Doc. So Dr. Reed is a board-certified family medicine physician, as well as public speaker and best-selling author. And she serves as the owner and medical director of MS Family Medicine Healthcare PC, which is a holistic practice that serves two locations in Garden City, Long Island, and Rosedale, Queens. So welcome, Dr. Reed. How are you doing today?
I'm feeling great. Thank you so much for interviewing me, Nisi.
You're welcome. I'm so glad that you're here. When I received notification that we were going to be meeting today, I was just so excited. I've been looking forward to this interview because I know that you're someone who is recovering from COVID-19. And that your regional newspaper, the Newsday, they had done a 4-article and video diary of your journey with COVID-19.
Yes.
What was that experience like for you? And when did you realize that there was something going on that was different?
So around the last weekend, the last week of March is when I started to have, my heart started racing one morning when I woke up. And the racing of my heart within 72 hours went to a cough that was very dry, discomfort in my throat, fever, chills, night sweats that were extremely drenching my entire body and my bed, headaches, body aches, nausea, vomiting, diarrhea, still having a good appetite, eating 3-4 meals, all of this within 72 hours.
Wow.
So the first sign for me was knowing as an athlete that if anything is abnormal with my body, I need to investigate it. And so the first thing was when I woke up was with that increased heart rate that was going in the 90s, because normally mine is in the 60s or 70s.
Okay. And so do you have any idea as to whom you may have come in contact with, where you may have contracted the virus?
Well, that's interesting that you say that, because as a family practice doctor, I have the 2 locations. And so even though we had the sign up on the door saying, if you have any chest pain, shortness of breath, dizziness, change in taste, smell, all of the different symptoms that could be associated with COVID-19, we still had people that would come into both of our locations in respiratory distress. So it could have been anyone. We don't know. But gratefully, I'm here to have this conversation with you. 4 of my staff members tested positive. Others had severe symptoms. They tested negative, but we also know that there's a false negative result that can happen where you could actually be positive, but your result will come back negative. And that happens in 20 to 30% of the time. So we don't know if those were the cases. But the key thing that I like to tell people is to listen to the subtle signs that your body gives you, that if something's abnormal, let's investigate it. And that goes not just for COVID, but just for anything that goes wrong with your body.
That's true. And many of the people that I have interviewed and people that I've heard about their battle with this, they've gone to their doctor's office or they've contacted them and they've told, not to come in, of course, for social distancing. But the other thing is they have not even tested them. So my concern is we have a large population of people who could have it, who do not know, who do not have access to any testing facility, or if there is a testing facility, they're not testing them.
Mm-hmm. And that's really key, because in the beginning, they were only testing if you had symptoms, and then you had to have certain symptoms. And then once a week, it seemed like the symptoms changed. So what we started to notice is that, you know what, these are the symptoms that you should have in order to get tested. But if something is not right, you have to be adamant that, you know what, I really need to be tested. But now it looks like we're able to get more people testing. At least in New York State, we're having New York State is paying for testing, so it's free. They're paying for the New York State residents to have COVID-19 testing and then also get tested for the antibody, and those are both free. And the antibody testing, we're seeing a lot of that along with the COVID-19 testing, not in the urgent care for free, but at these sites that are now set up in African American churches, which I think is key. Because
Yes.
We've been hit hard here, especially on Long Island and the tri-state area. We've had at least 10, 15 ministers who have passed away from COVID.
It's a lot of people.
Yes. Yes.
And in our community, one of the problems that we're dealing with, I feel, is, people who have one or two or more comorbidities, push them at
Yes.
risk.
Yes, and the comorbidities, besides being not at a healthy weight, which we sometimes consider obesity or being overweight, is hypertension, heart disease, diabetes, asthma, lung disease, autoimmune diseases. So more than likely, if it's not us directly, we have family or friends that do have those comorbidities, and we have to make sure we watch out for them.
That's true. Now, I know you mentioned you tested positive as well as members of your staff. And one of the questions I get asked often is about the test. People say that the test is very uncomfortable. Some people are very fearful of getting the test. So if I may ask you, what is that experience like with the test?
So for the test, they do take a swab. And when I went, they swabbed both nostrils. Within 15 seconds, you're finished. So I like to say those few seconds of discomfort is the answer, or leads to the possible answer as to whether or not you have COVID-19 or you don't have COVID-19. So even when it comes to mammograms, people will say, well, I don't like to feel that pain with my breast being squished by the machine. And I'm like, well, think about the pain and the anguish that you go through if you get diagnosed with breast cancer, and what does it happen and what's the effect on your family when they realize that you have something and they actually go through the whole process of treatment or healing or death. So which would you rather have? So for me, yes, I opted to have it done. My family, they were also tested. They all tested negative, but you have to put things in perspective. I want to know what's going on with my body. Everybody should want to know what's going on with their body. There's no reason why we shouldn't know if we have COVID or if we don't have COVID. If we have, quote unquote, been exposed to it because we're walking around without any symptoms, we need to know.
One of my models is, I never want a physician to tell me, had you come sooner, we could have helped you. We could have done X, Y, Z. So I don't want to hear that. That's why I go regularly, because I want you to tell me, good or bad, what's going on, what's preventable, what can we do, what's the treatment protocol, what I need to do, what are you going to do, how can we proceed, versus like you said, when it comes down to mammograms, even colonoscopy, all those things, I'd rather know and then deal with it.
That's true. That's very true. I mean, knowledge is key. And the more you know about your body and different diseases, the more educated you can be, especially when it comes time for decisions to be made about your health.
That's
and as
true.
a family practice doctor, I really push prevention. Let's not get to that point. And for me, going through COVID, I like to focus on, because somebody said to me the other day, is like, well, you're supposed to be the fit doc and you're supposed to be so healthy. How is it that you tested positive? And I'm like, because I was exposed to it. But at the same time, my immune system was prepared for this particular moment, because if I hadn't been taking care of myself, it would have been a lot worse for me. So what are we going to do so we're prepared the next time COVID comes, COVID-20 or COVID-21 or whatever virus comes up? What are we going to do with our body so that we're prepared to face whatever health challenge will come our way? Because this is not going to be the end.
No, I heard, I think it was Dr. Fauci who said that when the flu comes, whether the fall or next year, we can be right back where we started with COVID again. So we need to be prepared.
Yes.
Now, you mentioned about being the fit doc. What people don't understand is this is an equal opportunist virus. It doesn't care how healthy you are. If you're unhealthy, it's there. And you're right. You had exposure to it. So that was my next question about the fit doc. You're known as the fit doc. So tell us what that means.
So fit doc Michele Reed is somebody who leads by example. So if we're going to be talking about prevention, guess what? I am working on prevention. And that's in all aspects of your life, mentally, physically, spiritually. I want you to be healthy. So for the past 2 years, I've had an international retreat, Montego Bay at the Half Moon Resort, where we focus on your mental health, your spiritual health, your physical health, even your sexual health, because all of that makes you who you are. And so what can I do to help you boost up those different areas? And when you come to me as a patient, it's not just me looking at your heart. It's me looking at your family life. What type of work do you do? Do you drive to work? Do you sit once you get to your job? Or are you running up and down the stairs? Are you exercising? How's your nutrition? All of that is what I'm concerned about as a family physician. And FitDoc is my brand, FitDoc Michele Reed, that I take outside the office where I can go international and bring about the idea of you taking care of yourself in all aspects of your life.
That's beautiful. So for this FitDoc retreat, is that done once a year? How frequently is that?
Well, we did our second one, and it's been annually. But this year, I'm trying to figure out what we're going to do for 2020, because I don't think it's very safe right now for us to travel.
Yes.
So we're trying to figure out if it's going to be something in 2020 or we're going to push more so for 2021, because a lot's going on with COVID-19, a lot of uncertainty. So I'm trying to be patient and figure out which direction we need to pursue.
Okay. So how are you feeling now since being diagnosed with COVID?
I have my good days. I have my bad days. Every day I feel stronger. My heart rate still goes up and stays in the 90s. Last night before I went to bed, it was 103. Every now and then when I'm sitting and just resting, or even when I'm talking, feels like I can't get enough air. And my body sort of just does like what we call like a double gasp, like fatigue is still there. There are moments where I'm like ready to run a marathon and I go outside and I'm like, you know what, we're going to walk.
Yes.
So I haven't attempted to run, but it's more so just like always listening to your body, seeing what works best for you. Before I would work out in the morning, but sometimes, you know what, I don't feel like working out in the morning. So my routine might be in the afternoon or evening after I finish seeing patients, and even after I've had dinner. So it's really just paying attention to how I am feeling, because day by day, moment by moment, it feels different. I might decide to take a nap after this.
I understand. Now, what about your sleep? Has that been impacted at all?
Oh my goodness. During probably up until, because we're into like day number, I think I'm close to like 50 or 51. My son says day 47. So day 47 from the day that I had my first symptom, which was that increased heart rate, the tachycardia. Up until about the last week, sleep has been very erratic. There would be some times where I might get an hour of sleep, sometimes where I might get 3 hours of sleep or 4 hours of sleep. There were a couple of times where I I would sleep for like 5-6 hours and then wake up at 3-4 o'clock in the morning, just like, okay, where's the party? And everyone else is asleep. So it just varies. But then now over the past week, I've probably been getting about 6-7 hours sleep, because I figured out that it's best if I take a shower in the evening, exercise in the evening, and then I'm ready to go to bed once I finish exercising, because I've already had dinner before I've exercised.
Now, on the dietary side, in terms of nutrition, have you implemented anything different to help you, feel more energetic, or to help with sleep? What have you done differently?
Well, as far as with my energy level, I think I've always had a good energy level. I love to eat. I'm a pescatarian. Every now and then I have to have like a piece of pork. I drink a lot of water. So you see, I still have my essentia here. Was always taking vitamins, like multivitamins, vitamin C, because usually I like to say you can get your nutrition from your food, but sometimes I might not eat on the same schedule, but I'm still getting in my 3 meals per day. So the vitamin C, the multivitamin, the oregano oil, that helps with its antioxidant, antibacterial, antiviral. It's anti-everything except anti your health, because it keeps you healthy. Those and calcium and vitamin D. So those were always part of my regular routine for like the past couple of years. If anything, the moment that I did not feel right in my body, I was talking to one of my friends, and she was telling me that she was making a tea and her name is Vanessa, and she has her brand, V's Teas. And so Vanessa's tea is ginger, turmeric, garlic, and honey. So for the past 50 days, 40 something days rather, that's what I've been having 3 times a day, her teas.
Okay, and that's called V's Teas. I'll write that down.
V's Teas.
V's Teas, and it is garlic, onion, turmeric.
Yes.
And did I leave out?
So garlic, ginger, turmeric, and honey. No onions.
Okay.
No onions.
Okay.
One of my other friends puts onions in hers.
Well, we
And
know that turmeric, ginger, all of those things are very powerful with the herbs that help a lot. You also mentioned the oregano. So would that be like, not in the teas, but in terms of what you use? So is that simple?
I would normally do the tabs, or sometimes I would do the liquid
Yeah.
oregano.
I have the oil of oregano. You know, it takes some getting used to that taste, but you know, I do it quickly.
But just be careful because it can lead to increased gastritis or GERD. So
Okay.
it's recommended that if you do like 2 to 3 weeks on and then have 1 to 2 weeks off. That's the recommendation.
All right. Would it be better, you think, maybe just to use with water?
Well, I just take the pills and call it a
Okay.
day because I'm like, is
I'll
this
look for.
the week on or the week off? So I just take the pills every day and less side effects.
I've also, for my family at home, I've also purchased some apple cider vinegar and incorporating that too.
Yeah, some people say that works too. So, I mean, it's like whatever you feel is going to make you healthier. That's what I encourage people to do. And one of the key things is education by, talking to other people and also talking to your doctor. Because before you start taking any type of herbal supplements, you should make sure, vitamins, you make sure that you get clearance from your doctor because sometimes they can interact with prescription medicine.
Absolutely. And since you've gone through this experience, is there anything that you have learned about it that you didn't know before from being a patient versus when you did not have it?
Whew. I guess I learned that I still have to work on my patience as far as, I'm at home. It's my husband who's taking care of me. My children weren't really able to take care of me because fear of exposure to them. Because at the time when I was first diagnosed, they were 15. They celebrated their 16th birthday while I was still self-isolated. So I think that's one thing that I learned. And at the same time that, no matter how down and out I feel, that I still have faith. Still believe in God. And at the same time, if you listen, God will give you messages. And the message that he was giving to me was God wants me to share my story. And for me to be obedient and to respect what God has said to me. And growing up as a Christian, that's one thing that we've always talked about is obedience. So when I saw the opportunity to talk to you, Nisi, I was like, okay, let's
That's why
pursue.
I am a Christian as well. And I know the Lord talks about our people perish from a lack of knowledge. And for the African American community, are there any tips that you can share with our community of things that maybe they should consider doing now that perhaps maybe they didn't take seriously before or just felt that they just didn't have time?
So one thing I would like to say, probably the first thing, is have a relationship with your doctor. And if you do not have a physician, try and find a physician. The beauty of it right now is some doctors are in the office, but a majority of doctors have telemedicine. So you can make an appointment at your leisure. You don't have to get dressed up. You can be sitting at your dining room table or in your bed and have a conversation with a physician. And that would be the first step. The second thing is, once you see the doctor, be it virtually or in person, you should know what your numbers are. If you have hypertension, doesn't mean that you have to be on medicine for the rest of your life. What are the changes that you can do to decrease your blood pressure while you're taking your medicine? Is it maybe decreasing the salty foods that you have? If you have high cholesterol, everyone thinks that, okay, if I'm going to have fish is good, but then they also lump under fish, shellfish. So having too much shellfish can increase your cholesterol. If you're diabetic, if you're pre-diabetic, there's close to over 80 million people out there who are pre-diabetics. So know your numbers. And I think the third thing right now is they're talking about us social distancing. Since we do not know a lot about COVID-19, it is very important that when we go outside, that we wear our masks, because people are next to you who don't have any symptoms. And if they don't have any symptoms, they might actually be positive for COVID-19. And those are what we call asymptomatic. So it's key to wear your mask to prevent you from getting anything, but also prevent you from giving anyone anything. And when we say social distancing, respect the distance. You don't have to be all up in someone's face, at least 6 feet away. And when we say 6 feet, at least 6 feet. If you can be a little further away, that's even fine, because we do not need more people going in to the doctor's office or having to go to the hospital sick, because the hospitals are taxed as far as what they're doing right now. And even though things are getting a little better as far as numbers, they're not seeing as many hospital admissions, people are still getting admitted to the hospital. People are still coming down with COVID-19. But then I also realize that a lot of people are at home going through it because maybe they don't have insurance. Maybe they're not here legally and they don't feel comfortable going to the hospital or the doctor. So really check on people and use your resources. If there's free testing out there, go for the free testing. Everything doesn't have to be at the urgent care. The urgent care is making money. They're bringing in a lot of money because people are willing to pay the $40, $50, $60 copay or sometimes more. But why do that when you can go to your state health department and have a free test done?
Yes.
So education is always the key. And there are so many resources out there that we're not even aware of. And I think the last point is be aware of how you feel mentally and spiritually, and realize that there are other people that are probably going through the same thing, and be open to seeking help, to talk to a mental health therapist. Those are things, especially in our community, that people don't necessarily like to do all the time.
That's true. Mental health is vital. You know, we have to have that, because
Yes.
that's part of total wellness.
Yes, it is. Very much so.
I was in a Walgreens and I walked in there. I always wear my mask. I had my gloves. A gentleman came in behind me. He didn't have a mask. And his question was, can someone please tell me where I can go find a mask? I don't have any, because, you know, the sign on the door says don't enter if you don't have one.
Mm-hmm.
And I thought, wow, I'm going to be looking for some places where I can just buy some extra. So if I encounter someone else again that's in that predicament, I can say, here's a mask, you know.
Mm-hmm. But even if you don't have a mask, you can just use a bandana to make it, you know, nice and tight and cover your nose and your mouth. One of my friends had even sent me a video where she found on Facebook where they were using a bra and just taking one of the cups and using the cup to make a mask. So just cover up with something. Something is better than nothing. If you can't get an N95 mask or a surgical mask, realize they're in short supply, because there are doctors' offices, there are hospitals that are lacking or in short supply too. So bandana is fine, a scarf is fine. Just really, truly cover up.
Yeah, before we had masks, what we were using, my husband and I, were bandanas, you know, because that's all we had until we received our shipment. Well, Dr. Reed, I'm going to respect your time. I know you haven't been feeling well. Is there anything else you would like to share with our audience?
Well, I would like to share that May is my birthday month. I know it's mental health awareness. And one of the things that I like to have everyone join me in doing, because you can find me on Facebook, Fit Doc Michele Reed, and on Instagram, Fit Doc Michele Reed, and Twitter, Fit Doc Michele R. But what we're doing for the month of May is I'm challenging everyone to do 1 mile of movement. Because when we move, that helps to boost up our immune system. It helps to get those endorphins going so we feel good. And when we feel good, we look good. And you develop a good self-confidence. Because right now we're going through a lot mentally. So by doing that 1 mile of movement and posting it either to Facebook and tagging Fit Doc Challenge, we're making a difference in lives, because people who never did any type of exercise, they're either getting on a treadmill indoor, they're riding on a bike, they're walking around their house. If they live in apartment buildings, they're taking the stairs, they're outside on the streets, they're riding bicycles. Of course, everyone's all practicing social distancing and wearing masks, but they're being healthier. And that 1 mile is turning into 2 miles. I think somebody even did up to 8 miles the other day. But we're making a difference with our movement and making a shift to being more healthier overall, especially among our community members.
Awesome. And happy birthday to you. And
Thank you.
And I will be tagging you in that challenge. I have a Siberian Husky and I love walking her. You know, dogs love walks. So I will tag you for that. And
Thank you.
Ordering a hula hoop and a jump rope.
Get your steps in, get your miles, whichever way possible. I love it.
I mean, to me, wellness, if you find something that you can do that's fun, then you don't even look at it as exercise. You look at it as something that you enjoy.
That's right.
Now, where can people find information about the retreat?
Well, my website is fitdoc.com. That's FITDOC.com. And that's the overall website. And as soon as you just keep following that, we'll be listing information about the retreat. And then you can become a subscriber of the website, and we'll let you know soon as we get more information, because right now we're just waiting to see what's going on with COVID-19 before we make any further decisions about the next retreat.
I see you have your debut book, Mentally Fit, Physically Strong, The Fit Doc's Guide to Real Life, Real Fitness, Real Health.
That's right. And so you can pick that up on Amazon.com.
Yeah. And that was a bestseller. So
yes.
I definitely be looking for that and even purchasing some to give away as gifts. So
yes.
Thank you so much. Well, it's been a pleasure meeting you. I wish you well. Keep up the good work that you're doing.
Thank you so much. It was a pleasure meeting you, and I look forward to meeting you in person.
Okay.
Without a mask.